A partial denture is like a puzzle piece for your smile. It's a removable appliance, custom-made to fit your mouth and replace missing teeth. Unlike full dentures, which replace all teeth on an arch, partials fill in the gaps left by one or a few missing teeth. These dentures are carefully designed to blend seamlessly with your natural teeth. They restore your smile's appearance and improve your ability to chew and speak properly. Partials are typically made of two main parts, artificial teeth and a gum-colored base. The base is designed to be comfortable and discreet, often made from a lightweight acrylic resin. They are held in place by clasps that gently grip your existing teeth, ensuring a secure fit for confident smiling and eating. Partial dentures play a crucial role in maintaining good oral health and overall well-being. They prevent existing teeth from shifting into the gaps left by missing teeth. This shifting can lead to bite problems, difficulty chewing, and even changes in facial structure. Partial dentures restore proper chewing function, allowing you to enjoy a wider variety of foods. This is essential for maintaining a healthy diet and good nutrition. They also help you speak clearly, as missing teeth can significantly impact pronunciation. By replacing those missing teeth, partial dentures restore your confidence in social and professional settings. If you're missing one or more teeth, you might be a good candidate for a partial denture. People lose teeth for various reasons, including tooth decay, gum disease, injury, or age. Your dentist will assess your oral health, the number and location of missing teeth, and the condition of your remaining teeth to determine if a partial denture is the best solution for you. Partial dentures are often a more affordable option compared to dental implants or bridges, especially if you're missing multiple teeth. They are also removable, making it easier to clean both the denture and your natural teeth. Your dentist will discuss all available options with you to help you make the best choice for your individual needs and preferences. Section 4. The upside of partials, benefits you can smile about. Choosing partial dentures offers numerous benefits that enhance your oral health and quality of life. First and foremost, they restore your smile, giving you renewed confidence to smile, speak, and eat without feeling self-conscious. Partials improve chewing ability, allowing you to enjoy a wider range of foods and maintain a balanced diet. This is crucial for overall health and well-being. By preventing your remaining teeth from shifting, partial dentures help maintain the shape of your face and prevent bite problems that can lead to jaw pain and headaches. Moreover, they can improve speech clarity, especially if missing teeth were affecting your pronunciation. This boost in confidence can positively impact your social interactions and professional life. Section 5. Crafting your smile materials and the fitting process. Creating a partial denture is a meticulous process that involves several steps to ensure a comfortable and natural-looking result. It begins with taking impressions of your upper and lower jaws, using a putty-like material. These impressions capture the unique contours of your mouth and serve as a blueprint for creating your custom denture. The base of the partial is typically made from acrylic resin, a durable and lightweight material that can be color-matched to your gums for a seamless blend. The artificial teeth are usually made from acrylic or porcelain, chosen to match the shape and shade of your natural teeth. The denture will be fitted and adjusted several times to ensure a comfortable and secure fit. This may involve minor adjustments to the clasps or the base of the denture. Section 6. Navigating the adjustment, common issues and solutions. Adjusting to partial dentures takes time and patience. It's common to experience some initial discomfort or soreness as your mouth gets accustomed to the new appliance. Speaking clearly may also require some practice, as the denture can initially affect tongue movement and pronunciation. Eating with a partial denture can be challenging at first. Start with soft foods and gradually introduce harder foods as you become more comfortable. Regular cleaning of your partial denture is essential to prevent plaque buildup and bad breath. Your dentist will provide instructions on how to properly clean and care for your denture.